Thank you very much, Mthatha. So some parts of South Africa are in the grip of extreme weather, from biting cold fronts to heavy rains and dangerous flooding. The Eastern Cape town of Mthatha is still amongst the hardest hit, where aid and recovery efforts are still underway. As the country confronts the growing impact of climate-related disasters, so questions are being asked about how early warning systems could help save lives and even reduce the damage. So experts say the key to disaster risk reduction may lie in the timely alerts and better community preparedness. For more on this now, on aid and recovery operations during such times, we speak to Dr. Ahmed Bham. He is with the Gift of the Givers. He's the head of search and rescue. Dr. Bham, great to see you. Thank you very much indeed for joining us here on SABC News. It's been a devastating a couple of weeks for the Gift of the Givers, police, and a number of other organizations that have joined you in these search operations. But I want us to start here, not specifically focusing on Mthatha, but do we have suitable early warning detection systems related to disasters? Let's talk about overall now.
Morning. Thank you for having me, Priscilla. Thank you to the viewers as well. Yes, we do have early warning systems, Priscilla. As you see, the South African Weather Services do give timely warning systems out to communities. We've got the National Disaster Management Center, which do send a lot of communication out. And we do have till a certain level of early warning systems, But in disasters, in certain areas that we are, with all the early warnings that we do have, unfortunately, some of the disasters will just have the impact it's currently having at the moment, So a lot still needs to be done in terms of community education, in terms of those kind of things, more like using these platforms like social media and this kind of platforms just to warn communities much more. But to answer your question, yes, we do have early warning systems in place. We can implement and get better warning systems, but from the South African Weather Services, the disaster management centers, they issue those levels and warn citizens of our country of storms that are coming in.
Yeah, how can we improve on this, Dr. Bham? Given that, remember, I did say I'm speaking holistically. I mean, the Gift of the Givers was instrumental in assisting in Turkey when there was an earthquake there. How do we fare in terms of the rest of the world? How do we compare with countries in as far as, the optimum use of these early warning weather-related systems?
It's an interesting question you're asking. And if you take like Turkey, you take Japan, you take the tsunamis that came, a lot of those first world countries do have early warning systems in place, but yet the impact has been such that it's caused so much devastation.
Correct.
So from our side, bringing it a bit back home to South African side is just more to educate our communities, not building houses in floodline areas or so and so, and maybe just have more rollout, more preparedness, I'd rather say, before more what we can say response in a way, So more for preparedness, there's much more we can do in terms of that. But as a country, we do have those in place at the moment. And compared to the rest of the world, where you've also traveled to some of these disasters, you've seen the impacts. They have the best technology. They're using the satellites. They're using these early warning systems. But yet the impact is devastating. So I think a phase would be to have a good preparedness, but also for communities to know what to do when the disaster strikes as well, because those first few hours are really critical in saving lives, if I put it that way.
Yeah, those first hours are critical indeed. And I mean, it's been a couple of, over a week or more than that you've been in the Mthatha area, but you're still continuing, with your recovery operations there. What is the status there, Dr. Bham, in terms of still having to sift through some of the debris there? Your teams keep coming in and out from different parts of the country to come and assist. And, what is the challenge at the moment as the days go by?
I must commend the teams, especially the Eastern Cape Department of Health, the South African Police Services, the Defence Force, and all role players that played part, even all the other provinces, sending teams through us as Gift of the Givers in terms of they've done a lot of recoveries. As we're currently standing at the moment, we've got 3 people that are still reported missing, and searches have been intensified. It's going to go for another week. Our search and rescue teams are going to be pulling back today, but we'll be leaving our ground staff here, and the Eastern Cape Department of Health and other role players will be continuing. But while we were here, since the devastation has happened, as you've seen, many of the bodies have been recovered. I mean, totals have moved over 105 or so. And just with the 3 missing, a focus has been made now to try and look for those 3 kids, if I put it, over the next week or so, or over the next coming days, But it's just amazing to see such a multidisciplinary team and how South Africa, in terms of the government, private sector, NGOs, all came together just to assist. On the second point, you can see as well in the Western Cape, there's those storms brewing. Yeah. Our teams are assisting more on the ground level, and the Western Cape disaster management teams are on the ground as well, assisting. And it looks like, as the time goes on, much more disasters are striking, and the impact is becoming much more worse.
And I mean, with that impact becoming worse, Dr. Bham, I mean, this kind of work can be very taxing mentally and emotionally. I know how you've been encouraging your teams to keep going, but of course you keep changing just to make sure that everyone gets some rest. I mean, how are your members coping on the ground? I mean, I know you're providing support, different kinds of support for them, during this operation as it continues. Now you've got a situation also in the Western Cape that you have to deal with.
So in terms of what we've learned over many years is just to preparedness. As you know, our founder, Dr. Suleiman, has always told us, let's do things better. Let's have strategic areas where the NGO, especially in South Africa, we've opened up multiple warehouses in certain areas, pre-stocking just for that acute phase. And after the disaster, we've looked at rebuilding sustainability projects. Coming down to the teams as well, it's been really, every morning having these debriefings, motivating them. But the teams are so amazing, and you see that spirit of South Africans just want to help each other. So they come to the parades every morning, going out there, smiling, and they're working really hard. We had the Eastern Cape Department of Health actually arranged a debriefing session yesterday. It was really good to have that debriefing for about 2 hours. And after things, once they settle down, we'll definitely continue just to have a debriefing, just to assist our rescuers. Because understand, these rescuers are fathers. They have children, or their mothers as well, So it's devastating seeing something like this when you're coming also and thinking back of your family back home.
Dr. Bham, thank you very much indeed. And we really do appreciate your efforts as a country as you continue to assist these communities that are ravaged by all this devastation, not just in the Eastern Cape, but also in the Western Cape as well. Always great speaking to you, and appreciative of the great work that you do as the gift of the givers. Thank you very much indeed, Dr. Ahmed Bham, who is with the Gift of the Givers.